Hey guys, Oscar here with Gastroenterology Simplified. I'm a board certified physician assistant, and today we are going to talk about the landmarks of the colon. I need to make this clear. This is for educational purposes only, and I want you to learn from this. If you have any medical questions, please consult with your physician assistant. Why is extremely important to know the landmarks of the colon? When you do a colonoscopy or a flex sigmoidoscopy, the endoscopist will tell you, we found an abnormality in this area, this other area. When you go back and talk to the patient, you want to be able to pinpoint where the abnormality was found. So let's go ahead and start. If we go on the right side of the colon, we have the ascending colon, we have the cecum, right here is the appendix. Right around this area, we have the hepatic, flexure. Right here, we have the transverse colon. Right here, we have the descending colon. Right around here, we have the splenic flexure. Right about this area, we have the sigmoid colon. Over here, we have the rectum. And right over here, we have the anal canal. Why it is extremely important to know all these landmarks. And by the way, this is the left side of the colon, right side of the colon. And it is extremely important to know the landmarks because let's say the endoscopist does the colonoscopy and it tells you, well, Oscar, we found a mass at the hepatic flexure on this patient. So the hepatic flexure, we know that is around this area. So when we talk to the patient and we give the result to the patient, we know and we're clear where to pinpoint. You know what, Oscar? We found a mass in the cecum. So that would be around here. We found colitis in the descending colon. So you know that we are talking about this area. This area right here, the sigmoid colon, this is the most common area where you may find diverticulosis, which is not the acute condition. And when someone has a left lower quadrant pain and you suspect infection, then likely the patient is experiencing diverticulitis, which is the acute aspect of this, the acute infection. Just to wrap things up here, it is extremely important to know the landmarks of the colon because once the endoscopist is done with a colonoscopy or flex sigmoidoscopy, they're going to let you know, they're going to let the physician assistant know or nurse practitioner know, well, we found an issue in this area, in this other area. And your job as a physician assistant is for you to explain where the issue was found in the colon and what are the next steps. Guys, if you found this video helpful, please click like, subscribe so I can bring you more videos like this. I'll see you in the next one. Bye.